I'm really going to focus a lot on behavior. That's one thing I would say. Really focus on altering behavior. So we're going to try to target the avoidance and or safety behaviors, which I'll talk more about. Any oppositional behaviors. So behavior plans can have a position and can have a place in treating phobias. We're not going to reward or punish away the phobia itself, but we will address the behavior. And I always want to explain to parents that kicking and screaming, punching and hitting are not part of a phobia. They are an unhealthy response to a phobia. Okay, it's not the criteria. People don't meet the criteria for having a phobia because they punch and kick. They do have, that shows us there's intense distress. So that is part of the criteria. So it is certainly, yes, it's a sign of something we see there, but it's an unhealthy response to a fear. And that's what we're going to change. So we could put in a behavior plan to address that. We want to target tolerable, then let me know. So I try to give them a little bit more control, but still with the spirit of we're trying to let go of safety behaviors, right? So, and I want to do that before going into the exposure. So, you know, being in a room with this is just too much anxiety. Okay, well, what's the level we can start at? Well, maybe if we have the door open to this level. Okay, let's try that. So I just try to get them more involved in making decisions before the exposure. And I want to do it before the exposure versus they're in the exposure. Well, let's open it more now. Let's open it more now. Because I really want to be clear. Let's try to stick to whatever we're doing. Question here. So some other things here, when you're thinking about devising a list of potential triggers to challenge the fear, think about objects you can use. Think about any auditory, visual, olfactory, tactile, or any gustatory triggers that you can use. Routines. Family doesn't go on hikes anymore because of fear of snakes or bees or something. Child sleeps in the parent's room. You're not allowed to eat in restaurants anymore. These are things we need to shift and change. So, and I think these things happen not because families want to increase the anxiety, but I think they just don't realize it's happening. Most of the time, it's like little things like, oh my God, he's so sad. How can we go on a family hike now? Like, we can't do this. He's not ready. Maybe he'll feel better in a couple of weeks. So it builds up over time. Sometimes you have parental anxiety, but what if something does go wrong, right? So like we're going to go on a hike. What if my child does get stung by a bee? Because they might. It does happen. Well, part of it's going to be working with parents. Like we have to learn how to cope. So if your child was stung by a bee, what would you do? Well, my child doesn't have allergies to bees. He's been stung before. He's fine. But we would clean it. We'd probably give them some topical thing to help with the pain. It would hurt. And that's what we're going to do. But kids may get stung by bees post-treatment. And with some of these fears, you can see improvement as little as one session. If you're doing a long session, there are one trial treatments for phobias. Tend to be things like fears of like animals you can tend to do in like one session. Fear of the dark is harder because you can get over the dark, but you've got the whole sleep thing. I think that's more of a problem built in. Needles you can do, I think but you really would probably, actually, you know what, needles can be a little trickier. So when we, all right, just a couple of things here. So here. So think about before starting, you want to think about preparing. Make sure you've got needles, make sure you've got access to animals. That's what you're going to do. Think about the timing. You're not really going to treat a bug phobia in the winter. Best time to treat fears of storms, I usually try with like some kind of virtual exposure.